Thank you so much for joining us. My name is Nathan Tinker. I am the CEO of the Connecticut Pharmacists Association. We usually do this event as a lovely little cocktail reception in the atrium. So I hope your servers have been by with a drink and a nosh for you. If they have not, please complain to your own staff, not to mine. Well, we'll have everything together from there. Very glad to have you here. We've got several issues to discuss today about the interests of pharmacy in Connecticut. Obviously, with COVID continuing to rage, pharmacists have a major role in helping to fight that back. And I think some things we can talk about today speak directly to that, as well as some other issues that affect other parts of our legislative agenda and our constituencies. I would like to say a personal welcome to Representative Ritigliano, my hometown representative. Thank you for being here. And actually, I'm going to hand things over here to Jean to make some introductions of some of our guests who are with us so far.
Sure. Thank you, Nathan. And thank you, folks, for taking time out of your busy schedule. I know it's been crazy. I've been watching your Zoom meetings the last couple of days, and it's just completely mind-boggling. So I don't know how you're dealing with it all, but welcome. Congratulations on your election for the legislators, and Happy New Year. As Nathan said, we usually host this event in the atrium of the Legislative Office Building, and we have really great food. It's one of the better events of the year. And ironically, our 2020 event was canceled literally 2 days before the building was shut down from COVID. So it's nice to be able to have everybody back in a forum where we can talk about issues. So as Nathan mentioned, there's 4 key issues that we're going to go into in a little detail that are of interest to the pharmacists this session, as you can imagine. One of them being obviously the COVID pandemic and the impact that that has had on the citizens of this state and the healthcare professionals. Pharmacists who are allowed to administer the COVID vaccine there and do testing. We'll be looking into that issue for codification in the upcoming session. Also the public option, the insurance committee raised a bill, I believe it was today, on the public option, expanding that in Connecticut. And we want to ensure that there's a role for pharmacists in that discussion as well. There's also for some of you, the medical marijuana program, rather the legalization of recreational marijuana. There's some important steps that would need to be taken there for the medical marijuana program to ensure that that is protected and stays viable for the patients. And then finally, more of a housekeeping thing, the drug therapy management statute that that has been in for a few years between pharmacists, physicians, and APRNs. That one needs a little tweak as well. So I'm going to turn it back over to Nathan, and we're going to go through these quickly, and then for the legislators, open it up for some discussion. I see, so we have Representative Pettit, I see Representative France, Ritigliano, new Representative Farrar, and I think I saw Senator Berthel also join us. So thank you, folks, and I'm turning it back to Nathan.
Awesome. Thank you all for being here. I'm going to quickly introduce some of our partner organizations, because even though CPA represents one large group within the pharmacy contingency, we do have partners who we work very closely with across the board. So I'd like to introduce them and let them say a couple of words about their organizations before we dive into the deep stuff. So Lauren, would you like to introduce ASCP, please?
Sure. Hi and welcome, and thank you so much again for attending this call. So my name is Lauren Zaitz, and I'm the current president of the Connecticut chapter of the American Society of Consultant Pharmacists, otherwise known as ASCP, and there are several other members on the call as well. ASCP is an organization that represents pharmacists and healthcare professionals, really focusing on the needs of the older adults. So our pharmacist members are senior care pharmacists, as well as technicians that provide expert advice on the use of medications to older adults throughout the community. They're in a variety of practice settings, so it includes nursing and skilled care facilities, hospitals, and the ambulatory care setting, to name a few. And as the population of age 65 and older grows, senior care pharmacists really are becoming more and more vital. Our members have been really instrumental in the fight against COVID-19 as we are caring for a vulnerable population, and we're very excited to be represented today. Thank you, Nathan, for that introduction.
Thanks, Lauren. I don't see Steph Luan on the line yet. Steph Luan is the president is the head of the government relations committee of the Connecticut Society of Health and Hospital System Pharmacists, and they are another one of our great organizations that we continue to collaborate with and work with. Also like to introduce Phil Ritko. You know him as the dean of the UConn School of Pharmacy, but Phil, we'd like to say a few words about what the School of Pharmacy is up to.
Sure, Nathan. Good evening, and good evening, everyone. And appreciate the invite to this evening's event. Wish we were in person. I've been to just about, I think, all of our receptions in past years, and I always enjoy the interactions. But my name's Phil Ritzko. I'm the dean of the UConn School of Pharmacy. Dr. Pettit, I know you know us well because you've been at our school. I know Tom Buckley has invited you up, and you've spoken to several of our classes in the past. So it's good to see you. Just to give you a quick update, obviously the School of Pharmacy at the University is our flagship university here in the state. We've been in existence for, actually this past October was our 5th. So we long established relationship in our state of Connecticut in educating and providing pharmacists in our workforce and researchers in the area of pharmaceutics and pharmacy field. Right now, because of the pandemic, our school has a role in a lot of the initiative going on in reference to the pandemic, in particular regarding the vaccine. Currently, we have a faculty member, Dr. Jen Gerardo, whose practice site is at the Connecticut Children's Medical Center, is on the governor's COVID-19 vaccine task force relating to the distribution and administration. So Dr. Petno, you mentioned that before. That's the top subcommittee that's involved with, and I have been listening in on some of those meetings, and yeah, it's very difficult decisions that they're making around recommendations to the governor. We're also actively training and certifying pharmacists in the state of Connecticut as immunizers, which we have been doing for a number of years, but now in particular because we're the state institution that has the ability to certify and train immunizers, which right now is extremely critical given that we need more immunizers to provide for the COVID-19 vaccine. And I want to give hats off to Dr. Jill Fitzgerald, who's the director for our experiential program and for our continuing education and professional development office, because she's been working in conjunction with the Connecticut Department of Public Health in developing and implementing a new program for healthcare providers who are non-pharmacists to certify and train them to administer the COVID vaccine. In fact, it'll be actually moving off the ground within the next couple of weeks, if not the next week. And so we'll be able to maximize that area. Our students and faculty are also actively immunizing and involved in various in our health systems throughout the state of Connecticut, and even within the university itself, and providing the vaccine to based on the distribution set by our state. So we are actively involved in that whole process. I'm not sure if some of you have seen recently the president of St. Francis Hospital, Stephen Burke, who's a pharmacist, actually had a press conference this past Monday where he just recently went through our immunization certification program at UConn, and he was administering the vaccine, his direct reports at St. Francis Hospital. So it's kind of neat to see a pharmacist in that position and sort of not only talking the talk, but he's walking the walk regarding actually actively administering the vaccine to his staff. Our students are also involved with the contact tracing in our state. And we've been doing that again in conjunction with the Connecticut Department of Public Health. We were also instrumental involved with some of our pharmaceutical science faculty, in particular Dr. Robin Bogner, with the manufacturing of hand sanitizer earlier on during the pandemic when there was a shortage. And she was also providing, only making it, but also providing the recipe to pharmacists across the country to have them in assistance in that area. And so we've been involved in a lot of different fronts as it relates to this pandemic, and we continue to do so. And I personally am very proud of our faculty, staff, and students at our university for all in that respect. So again, Nathan, thank you very much for this invitation.
Thank you, Phil. And last but not least, the Dean of the University of St. Joseph School of Pharmacy, Dr. Jim Hankel. Jim.
Thank you, Nathan. I'll keep this very brief because we have a lot of things to talk about. Just for those of you who don't know about USJ, our model of education is a bit different. We're located in downtown Hartford, within walking distance of Bushnell Park. We're in the Excel Center. And we're a 3-year post-baccalaureate program that produces PharmDs just as all other schools do. And our students tend to be a little older, a little more mature, if you will, than those who come in as undergraduates. They require a bachelor's degree. We're mastery based. And we offer an alternative to the more traditional 3-year programs. Our students, like Phil has also said, our pharmacy students are all certified immunizers, and they are all volunteering and participating to the extent that they can, helping anywhere that's needed to try to get the effort off the ground. We have a number of our students here on the call. Have a couple of alumni that I see, and I appreciate all of their efforts and what they're doing to help the cause. I think at that point, I'll stop and let's get on with talking about the issues that our legislators need to hear about.
Excellent. Thank you, Jim. Welcome to Representative Steinberg. Saw your name pop up there. Glad you could join us. All right, so let's pop into the issues, as it were. So right now, there's about 6,000 plus licensed pharmacists in the state of Connecticut across all the various practice areas that they work in, and over 900 pharmacies, including community pharmacies, hospitals, compounding pharmacies, specialty pharmacies, pharmacies in nursing homes and long care facilities, et cetera. It's quite a broad range of numbers. And we spend about $5.4 billion a year on prescription drugs in Connecticut. So it's a substantial piece of investment, and between Medicare, Medicaid, and private insurance, billions and billions of dollars go into this business one way or the other. But the one thing I want to point out as we move along here is that investing in pharmacist services is actually a money saver. Pharmacists can provide services and support to other healthcare providers and teams in ways that actually can help to lower the costs and improve outcomes. And so that's one thing I want you to think about as we're thinking about some of these legislative issues, is how we might be able to leverage pharmacy and pharmacists even further as we move forward in order to help drive down costs and improve outcomes. So let's talk briefly about the legislative priorities. Of course, over the past 10 months now, I forget how long it's been, there have been a number of executive orders that have impacted pharmacists and pharmacies' ability to do their jobs, and to and asking pharmacists to help in the fight against COVID. We're going to talk about a couple of those because I think it's important to keep in mind that codifying some of these authorities that have been put into the executive order and codifying the statute will actually help continue to enable pharmacists to do that. Executive Order 9Q was the one to authorize pharmacists to administer and order COVID-19 vaccine for patients aged 10 years and older. Very important as we continue in through the school year and into the next school year. And it also allows pharmacists to administer the flu vaccine to patients 10 and older under a healthcare provider's order. So a little bit different way it's done, but the outcome is the same, that pharmacists are able to provide those immunizations to patients 10 years and up. Executive Order 7KK, which came out, I believe in October, back somewhere, I'm losing track of COVID time, enabled pharmacists to provide end-to-end COVID testing, including testing systems authorized under FDA emergency use authorization, etc. And this has allowed pharmacists to greatly increase the number of tests that can be performed and the locations in which those tests can be provided. And again, codifying this will make it that much easier going forward to continue to provide that service to the community. I know the public option health insurance is going to be one of the big points of discussion as we move forward this year. In general, we support it with some modifications. There are a couple of things we're concerned about and to keep in mind as it develops. One is access. In our discussions with some of the agencies in prior years, it was suggested that there might be only one distribution and pharmacy benefit manager for that program, which would, of course, severely impact the ability, the competitive space for chain drugstores as well as independent pharmacies in Connecticut. I'm concerned here particularly about independent pharmacies. If they are not part of the network, that would be basically the death knell for independent pharmacy in the state. Given the size and scope of what that insurance program would probably look like, not having the ability to buy and access medications through an independent pharmacy, which in many cases, especially in our more rural communities, are the only local pharmacy, would be highly, highly detrimental and severely limit patient access. Second issue, we're concerned about drug importation from Canada for the simple reason that it jeopardizes patient safety. The key challenge here is that it undermines the Drug Supply Chain Security Act, also known as track and trace, which is how the United States keeps an eye on its drug supply and keeps it safe. Pharmacies invest a lot of money, time, and effort in developing those and supporting and maintaining those track and trace systems. Drug importation would largely go around that system. And the same problem comes with Canadian versions of drugs being intermixed and commingled into the American drug supply. And it would be very difficult to keep them separate, very difficult to manage and administer those sorts of things. And again, all this leads back to the issue of jeopardizing patient safety and access of patients because of operational disruptions and so forth. Jean had mentioned revisions to the Collaborative Drug Therapy Management Agreement Statute. This is a law that allows pharmacists to create partnerships with doctors and APRNs to work in team situations. Right now, those are limited to one-to-one relationships. If you are a pharmacist working in a medical practice, you have to create agreements with each individual doctor or APRN in the practice. We would like to suggest that be changed to be collective, that the agreements would be for the full practice, not just the individual doctors. Also suggest that reporting periods, which right now requires that pharmacists report every 30 days on patients that they are overseeing to the physician, be changed to be required to report encounters within 30 days. Right now, they must report every 30 days, even if there isn't an encounter with a patient. So changing that would make it easier for pharmacists to do their job, reduce paperwork, while at the same time maintaining the level of service and productivity for both. There's some other issues as well, which we can go into separately, but those are the key ones. And I think, one very special and important reason to consider doing this is that we have a fairly restrictive drug therapy management agreement statute, which means that we're losing pharmacists and, for that matter, doctors to states that it is easier to create these relationships in. And so in order to be competitive with other states, we need to be able to provide pharmacists the work environments and capabilities to make it worth their while to stay in Connecticut and work in Connecticut. Recreational marijuana, I understand today that there's been some movement that's actually going to be sitting in the governor's budget as opposed to a standalone bill, which is interesting. We just want to point out that whatever happens with recreational marijuana, a primary goal should be protecting what is the Connecticut's medical marijuana program, which is really one of the greatest and gold standard for medical marijuana programs in the United States. Over 40,000 patients in the state rely upon it every month. And there are a number of issues and tweaks that we believe we could bring to the medical marijuana discussion that would not only enhance the ability of the recreational program to be safe and legal, but would also, more importantly for us, protect the patients who are already utilizing and will continue to utilize the medical marijuana program if indeed recreational marijuana moves forward. One of the other issues which is worth considering, although I don't think we have a bill on the offing for this, in December, the Supreme Court of the United States agreeing with the state of Arkansas said that PBMs, pharmacy benefit managers, can indeed be regulated by state law. For ages, PBMs have argued that their services are actually regulated under ERISA, and therefore are federal and not capable of being regulated at the state level. Supreme Court threw that out, said that no, PBMs are not preempted, states are not preempted by ERISA in attempting to regulate PBMs, and that they actually have the right to do so. This has to do with transparency and how PBMs charge fees, how they work with pharmacists, et cetera, et cetera. So this is a vital part of defending the ability of pharmacists to do their jobs and to be reimbursed fairly for doing that job. One of the issues here is that PBMs can and often do reimburse pharmacists for less than the actual wholesale price of the drug that has been distributed. So when pharmacists are losing money on drugs and medications, they are hugely, obviously, disincentivized to actually continue to do that. And this has been part of what has destroyed large swaths of our independent pharmacies in Connecticut and other states. But it's something we should consider now that Supreme Court has made this capable of responding to PBM tactics. We should rethink that and look at that in the future as we go forward. So that's kind of a quick overview of the key issues. I do want to suggest you join us at ctpharmacist.org/Connecticut. Well, we are setting that up as a resource page for all things legislative, including introductions to these topics, a little more in-depth data about what's going on in pharmacy in Connecticut, and some introductory videos and so forth about what it is that pharmacists actually do. I know that you encounter them a lot at your local pharmacy, but there's a broad range of roles that pharmacists play, and we introduce you to some of those as well. So with that, I am going to stop sharing my screen, and everyone will pop up. And Jean, have we had other folks join us that you want to mention?
We have Representative Robin Comey, Representative Eleni, I hope I pronounced that right, Cavros DeGraw, Representative Kathleen Kennedy and Representative Jillian Gilchrist.
Excellent. Well, I'm actually going to open up the floor to our legislators to say a few words, and few or as many as you wish. I think I'm going to ask first Representative Steinberg to pop in and say a bit about what the Public Health Committee is thinking and working on. If we could.
Well, thank you for hosting this. I've learned a fair bit today. I confess I was also on another Zoom call simultaneously. And I always question how much I assimilate under those circumstances. You've given us a lot to think about. Typically we think about the continuum of provider care, starting with the MD and now progressing down to the PA and the MA. But it's been clear, particularly during these past 9 months and going forward, the pharmacists have an increasingly important role to play. We've been a little bit on the hesitant side in terms of really exploring changes of scope of practice. And certainly there has been some resistance to some of the expansion of vaccine authority that you've requested, but I think that we have to look on those things with fresh eyes. Similarly, as you're aware, we've had some conversations about the role of PBMs, and we look particularly to what other states are doing as well to figure out what the right balance is to ideally make sure that the consumer is protected and yet they have access to the widest range of medications at affordable price. I was surprised to hear you speak out so energetically against the idea of importing drugs from Canada. I'm not quite sure I buy the argument the way it was presented, and I'd like to know more. But I would say overall, you have given us a lot of reason to think further, and we'd be glad to engage further on some of these suggestions.
Thank you. Always, any questions, comments, complaints, suggestions, we are, of course, always happy to engage and respond. Dr. Pettit, actually, would you have any thoughts, comments?
Well, to follow up with what Jonathan said, as our chair of public health, I think that the scope issues are important, but we were told last summer by the Department of Public Health, given the fact that the resources were stretched so thin that they were not willing to take up anything that involved scope issues per se. So we may be somewhat limited in that regard. We haven't yet gone to the mat in any of the issues at the moment. The other issue we're facing is, I guess what everyone's been calling the committee's bandwidth, what subjects we can take up. Obviously, the pharmacies have been very helpful in terms of getting the nursing home residents and staff vaccinated, and what role they'll play. The allocation committee subcommittee today decided we're going to vaccinate people 65 and up with comorbid conditions, and people with comorbid conditions. And the numbers that I saw was over 700,000 people. So it's a big number, and I think the biggest issue is going to be the absolute supply of vaccine, which I think we're clearly not going to have enough early on, though. In the media, Moderna has said that they may up their order from 20 million to 100 million doses for the US by the end of February. If we get 1%, that's 1 million doses. That means 500,000 people potentially, but I haven't seen verification of that locally. Finally, I think the PBM issue is a critical issue. When it was discussed in our committee, I can't remember, I think it was 19 as opposed to 20. Tremendous amount of confusion about the role that they play. It became clear that the local pharmacists seem to be getting the short end of the stick in this regard, and it clearly needs some attention. So whether or not that comes through our committee at Public Health, they're probably more likely to go through insurance. And I'll quit there and let other people comment until we get to very specific questions or issues.
Thank you. Jean, who should we have next? I'm trying to keep
Well, we have Representative Ritigliano from General Law, and we also have Representative Comey representing the Insurance Committee. She's vice chair there now. So,
good evening, everybody. It's Dave. I am in more of a listening position on this Zoom call than a speaking one. So I appreciate everything you do, and I am listening intently.
thanks, David. And today on the General Law Committee, Representative Ritigliano is the House ranking member there. They did speak about the recreational marijuana bill. And as Nathan alluded, it will not be a separate bill that is raised by the legislature, but instead it appears that the governor will have it in his budget. So it will be a budget bill that will be coming through the Judiciary Committee. So, as Nathan mentioned, we have some concerns about the medical marijuana side. And in states that have passed the recreational for adult use, the medical marijuana programs have suffered. There have been issues of supply and other things happening. So because Connecticut has such a wonderful model program across the country, we would hate to see anything bad happen to that program, which is doing so well for so many patients. So there's several provisions there that we would wish would be included in legislation to protect that program. So, but thank you, Representative Ritigliano, for that.
Yeah, Gina, I'd hop in there just to say on the recreational marijuana, we had a discussion yesterday with the chairs and vice chairs and ranking members of public health, and there was again some consternation raised that there appears to be an attempt to end run the public health committee. There's a lot of concerns about the potential public health risk of recreational marijuana in terms of the neuroplasticity of the brain, kids, people under the age of 25, the low, but probably real potential for addiction, motor vehicle accidents. In addition, our defense industry here, where people need to be able to pass tests to be able to work in many of with our defense contractors, and it's clearly been an issue in Colorado and other places where they have defense contracts. So we thought that at some level we should be involved, at least from not everybody, but most of us thought we should be involved from a public health point of view, and where it ends up going, judiciary, general law, or somewhere else remains to be seen. But I hope they won't ignore the public health issues.
That's probably a question for leadership. And I know this is really hard in a Zoom world, and it's hard even in an in-person world, but it might be worthwhile to have a public hearing with multiple committees, judiciary, general law, public health, all those committees of cognizance when they do hear that bill, because of the wide implications.
Maybe breaking our record there for the amount of time for public hearing at that. I'm State Representative Robin. I'm State Representative Robin Comey. I represent Branford, which is the 102nd district. I have graciously moved from public health committee last 2 years, and I'm now vice chair of the insurance committee. Thank you so much for your invitation. This is very informative, especially with the presentations and being able to be in an environment here where we're able to all talk together at one time in this Zoom environment. I think, and appreciate you sharing your priorities with us. I think it's the pharmacy industry is critically important, as we've seen, part of the healthcare system that we have, especially even more so as we go forward through this COVID environment. I appreciate you commenting on the public option. Certainly, as you know, is a big focus of the committee, and appreciate your suggestions to modify some of the portions of the bill. And I think as we, with your PBM reform, I am glad you brought that up. I know that as state representatives, we've heard over the past 2 years, well, I'm sure before that, but I've only been in office 2 years, very much from our local small independent pharmacies. So we very much hear from them a lot, and have seen in my district, have seen, one close as well, and want to continue to take into account ways that we can improve improve the competition, the playing field for that. I unfortunately will have to step off in a short time as soon as I just a minute or so. But I thank you so much, and I turn it over to the rest of you. Thank you.
Thank you. Thanks for joining us.
Thanks, Representative. And just a comment on the public option, as Nathan mentioned, when it came up last year, I know this year the bill is kind of gelling a little bit more, but when it came out last year, the system that they were going to use for the pharmacies was the system they're using for the state employee health plan, which is CVS Caremark. So that is just its own network that cuts everybody else out, independents, other chains. So that is really the concern here. The more people you send into these networks that can't use their local pharmacies, that becomes obviously a problem for small business, for larger business, for everybody in a community that may not be served by that particular entity. So Nathan, we also have Representative Gilchrist, and she's now a vice chair on public health. So if she may want to chime in and offer some comments as well.
Sure, thank you, and I apologize for my weird setting. I'm in the car, but nice to be with you tonight. I was late, so if you could send the PowerPoint, that'd be fantastic. I'd just love to know priorities, but so far I've been really enjoying getting to serve on the Public Health Committee and serve as vice chair. I've been in on a lot of great meetings and learning a lot, and so I look forward to working with you and partnering, so thank you.
Thank you.
And Representative France, I can't see if you're still on with my particular view. He is the ranking House member on the Appropriations Committee. He's been on that committee for a while now, but he's moved up to the ranking. I don't know if he's still with us and would like to add a few comments. Not seeing.
I think he jumped off.
Okay. And Senator Berthel, I don't know if he's still on with us. He's the ranking senator. Oh, good, Eric. He's the ranking senator now in the Human Services Committee, which deals with Medicaid and other issues. And one of the concerns we're having, Senator Berthel, is many of the pharmacists are talking about the vaccinations of COVID and asking if there's, what is the administration fee and the other things. So my understanding is Commissioner Gifford is working on that now and will be issuing a bulletin, some kind of provider bulletin for all the providers about, vaccinations and other pieces related to COVID.
Yeah, thank you, Jean. That is my understanding as well. And certainly as we continue to work through this, what is really the very initial rollout of the vaccine, it's only been a few weeks where it's very fluid. I think there was some mention a moment ago about the, the whole rollout to phase 1B and how that's going to work with Dr. Pettit speaking to supply and how many people we can get to. So very much a work in progress. But as you mentioned, I am the Senate Republican ranking member on Human Services. I'm also ranking on banks and on the Education Committee, which may not appear to be committees of cognizance with respect to the recreational marijuana discussion, but certainly will have an important role in where we land with all of that. Education obviously will have to come up with some creative solutions to how we address teachers who are recreational users and how schools will address that. We'll be dealing, I'm sure, with the State Board of Education on issues with dealing with students who are perhaps arriving at school in an intoxicated state. Banks will have probably the hardest part of this outside of judiciary because, as you know, right now, it's illegal for dollars that even the medical dollars that are collected as part of the medical cannabis market in Connecticut to cross state lines. It's a felony to do that. So the banks and credit unions that are involved in that practice in Connecticut have the same challenge as any other state with regard to handling money that has to do travel across state lines, interstate commerce. So there's a lot of, I would argue that just about every committee in the building will have some facet of involvement with recreational use. I agree wholeheartedly that we have to keep the medical market alive, well, protected. I guess I can go on record here and say that I will probably not support any recreational use legislation. However, I'm not so narrow-minded as to think that it would not be good to support making sure that whatever comes out of that legislation and wherever we land with recreational production, that it meets the same standard, the same quality, the same acknowledgement of what the potency is of any particular product that's being produced that we have placed upon the medical market. We know if you go to buy medical cannabis today that it has a certain percentage guaranteed, laboratory tested, guaranteed of THC and other cannabinoids, however you pronounce that word, I never get it right, that are in the product. We need to assure for the safety of every person who may indulge in recreational cannabis going forward that the recreational product is just as good, just as safe, and I'll say it, just as fun, right, as it should be. Otherwise, we will simply create an even more robust illegal black market for it, because that market will respond and will do whatever it can to try to destroy the legal market. So I didn't mean to go off on a tangent about recreational marijuana, but it's going to be a very interesting time for us along with everything else that's going on. But I appreciate the opportunity to be here. I have a local meeting I have to go jump onto now. I don't have to get in the car, but I just wanted to say hello. Thank you for what you do. I have a bunch of independent pharmacies in my district and some big ones as well. So I appreciate what you do and your concern for good delivery of healthcare in Connecticut. So thank you, Jean, for giving me a few minutes to address everyone.
Thanks, Senator. Thank you for joining us. Representative Kathleen Kennedy is also with us, so maybe she would like to say a few words.
Hi, Jean. How are you? And hello to everybody. I'm actually just like Dave Particuliano. I'm just listening. I learned a lot of important things today. During all of this COVID, it's interesting. We just had 2 pharmacies open up in my districts. I represent the 119th, which is parts of Milford and Orange, and a very long time local pharmacy closed, and another one opened in its place, and another pharmacy in Orange, an independent pharmacy, just opened up last week. So it's all been very interesting to listen in on this. So I appreciate you putting this together. I wish it could have been in person as well, but this has been very helpful. So I thank you.
Great, thank you. And we have Representative Eleni, am I pronouncing that right? Cavros-Degra. She's a new freshman from Avon and Canton. And welcome and thanks for joining us.
I have to tell you, no one ever gets it right the first time, so great job, because that was exactly correct.
That's it, Eleni, okay.
Thank you so much. I also am listening. I'm sorry that I hopped on late. Like Representative Gilchrist, I would love to see the slides from this, or if there's a recording, would love to get that. I am a new member, obviously, of the legislature, but also of the Public Health Committee. We have both in my district people who own pharmacies, as well as quite a few pharmacists who live here. So that's why part of the reason why I hopped on today. I just wanted to learn as much as I possibly can at this early time. So looking forward to learning more, and I appreciate all the work that you're doing. So thank you.
Great and welcome. And Representative Kate Farrar, I hope she's still on. She jumped on very early. She's a freshman from West Hartford, but she's really not a freshman. She's been an advocate in the building for many, many years. And if she's still on, I'd like to invite her to say a few words.
Don't think she is.
You are? Okay. And we are joined by Representative Carrie Wood from Newington. She is the new actually, I'm sorry, Rocky Hill. She is the new House Chair of the Insurance Committee.
Hi, good evening, everyone. Yes, I'm Carrie Wood from Rocky Hill. I also represent part of Newington, so you were correct with that, and also part of Wethersfield. And thank you for the invite. I am the new co-chair of the Insurance Committee. So I have been taking a 2-month crash course on insurance and real estate 101. I happen to be a commercial real estate agent. So the real estate side is really exciting to me. Insurance is overwhelming, but exciting as well. So I look forward to working with everyone. Thanks for having me.
Thanks, Carrie. And I think just before you hopped on, we were talking a little bit about the public option and the concern that the pharmacists have about making sure that the pharmacy benefit portion is open to all pharmacists to participate and not just say the state employee network, which is one company, CVS Caremark. So that is, you'll be hearing a lot more from us on that issue. So Nathan, I'm going to turn it back over to, I'm sorry.
Jean, it's Phil. If I could just say a word, Carrie, I'm in your district. I live in Rocky Hill, Connecticut. So I hope to meet you in person in a short time future.
Yeah, same here. And I'm surprised we haven't met. I've knocked on the district doors now 4 or 5 times. So I apologize if I've been to your house and missed you, but look forward to meeting you, Phil.
Thank you.
And Nathan, I'm turning it back to you. I think we've touched all the legislators. If I've missed anybody, please let us know.
Absolutely. Well, thank you, Jean, and thank you to our legislative friends for joining us today. I did want to make a couple of point out a couple more of VIPs kind of from our group. Rob Pacone, who is the current president of CPA. Rob, do you want to say a few words?
Good evening, everyone. Thank you, Nathan, for the opportunity to say a few words. On behalf of the CPA, both the membership and our board of directors, I want to thank you for listening to the concerns that we've brought to your attention tonight. And just please know that any one of us is available as a resource to you as you begin to process this. Tonight was a download, if you will, and then becomes the hard work of you figuring out how to synthesize it together and turn it into meaningful legislation and move it forward. So please do not hesitate to reach out to any of us. Thank you.
And I would also like, thank you, Rob. I'd also like to invite Sean Jeffrey to say a few words. Sean is on the board of APHA and involved in every aspect of pharmacy in Connecticut, as far as I know. Sean, would you like to say a little bit?
Well, thank you very much, Nathan. I appreciate the opportunity to have a chance to say hello. And I'm sorry that Representative Comey had to step off because, you know, as politics is local, Robin represents our district in Brantford, and our children actually are in a children's theater program together. So I have a very good working relationship with Representative Comey. And as Nate was saying, I'm one of the trustees for the American Pharmacists Association. And our state association, the Connecticut Pharmacists Association, works very closely with initiatives that are happening nationally. We're very closely aligned on the issues of importation and how we can better promote the value of the pharmacist. And we appreciate all of you spending some time listening to and hearing from the good work that we've been doing during COVID. Yesterday, I had my first chance to vaccinate somebody. I just got trained as a result of COVID. Spent 21 and a half hours, thanks to Jill Fitzgerald in the school, to become an immunized, certified pharmacist immunizer, and was able to deliver vaccines even to my mother yesterday. So, you know, there's a lot that we can do if you give us the opportunity, and we look forward to continuing to work with you throughout the course of this legislative cycle. So thank you.
Thank you, Sean. With that, I think I'm going to bring our meeting to an end. We really appreciate the time you've spent with us today, listening to the pharmacist interests and issues going forward. I'll make sure that all of you receive the brief with a little more detail. We have a brief to share with you as well that goes in a little more detail on each of those topics and the challenges and suggestions we have in relation to them. I do want to thank all of our students who joined us today. If all students raise your hand and give a wave, we have a great representation from both of our schools of pharmacy and appreciate their support and help in making all of this happen. And finally, just, you know, good luck to you as legislators as we head into the session. I know that there are a lot of of pieces still to be put in place and a lot of issues that are going to be extremely challenging for you. I hope, though, that you will, as Rob pointed out, come to us as a resource and as a sounding board. A lot of the people who are on this call today have been working in this field and in the government affairs piece of it for a long time and know a lot about it. And so what we can do, we can, and we hope that you will take advantage of that. So with that, Jean, do you have any final words?
No, I just want to thank you folks. I know you're on Zoom meetings all day long, so you must just be totally zoomed out, but thanks for joining us. As Nathan said, we have follow-up material that we'll make sure you all get. You have several groups of different pharmacists here, which is good, so you get all different perspectives from the field. And we look forward to working with you in this virtual and difficult session. But again, as Rob said, please reach out if you have questions, if you hear something that you don't quite understand or just need more information, please use this as a resource. We'd be happy to help.
Can I ask a question before we all go? I
Sure.
probably missed this, but is anyone getting trained on or any workplace that you're in getting trained on vaccinations? I know that CVS and Walgreens names were dropped, but are any of the independents or other people on here getting trained there?
Absolutely.
So, yeah, I mean, there was two things. You have two questions there. One is the training. One is the actual pharmacies providing the service right now. And right now, independent pharmacies and so forth are not, because the guidance for that from HHS just came down in the last couple of days. That is going to be a slow rollout. So right now, the vaccination is largely being done in hospital systems, in nursing homes, and within health provider networks as well. And to be honest, a lot of the people on this call are doing that already. Sean talked a little bit about doing it, but most of the students on this call are actually certified for immunization too, and are working on this on a broad range. As Department of Health rolls out the broader vaccination plan, that will become even more imperative to have local community independent pharmacies providing immunization services and vaccinations. And so, as an industry, we are preparing for that and making sure that our members have the resources, the certifications, the registrations with DPH and other organizations in place to make that happen as quickly as we're allowed to do that.
And Nathan, if I can just add for Carrie, we at the UConn School of Pharmacy are one of the only group in the state of Connecticut that is training and certifying pharmacists, and we've also working in conjunction and coordination with the Connecticut Department of Public Health to provide a certification process and program for auxiliary healthcare professionals such as dentists, EMTs, et cetera, to be able to administer the COVID vaccine during this Emergency Use Authorization Act. So again, we're strategically trying to increase the number of immunizers in our state and hoping to ramp that up even more so in the coming weeks.
That's really great to hear, because on our side, we're getting this really positive information on the amount of vaccine that will be coming with new, FDA approval for AstraZeneca and Johnson & Johnson and like 7 other pharmaceuticals following. So I think, the more the merrier that we have able to, disseminate. I know the Biden administration was targeting about 1 million vaccinations a day, and let's meet that and exceed it and, get this behind us. So thank you all for working towards that effort. That's really great news.
Appreciate the question and appreciate the support. Absolutely. Any other final questions, comments, complaints, or suggestions? If not, thank you so much for joining us again. We'll be in touch, and please be in touch on your side as well. Thanks a lot. Take care.